PAAC is part of a national consortium funded by the National Institutes of Health RADx-UP initiative to increase COVID-19 testing capacity and uptake in underserved communities.
PAAC has enabled us to put together a really innovative partnership between multiple entities. This includes federally qualified health centers, including the Waiʻanae Coast Comprehensive Health Center, the Hamakua Kohala Health Center, Bay Clinic, Molokai Health Center, and the Waimanalo Health Center. In addition, we partnered with the Department of Education, charter schools, as well as the Department of Health and community members in each of these communities across the islands.
I oversee the testing unit of PAAC, where my role is to help build capacity for community and school-based testing and assist with interventions to increase the uptake of health services to mitigate the spread of COVID-19. In addition to this, we recognized early into the COVID-19 pandemic that communities we have worked closely with for years have already experienced health disparities and would be more vulnerable to severe COVID-19.
Underserved communities in Hawaii, including those composed by Native Hawaiians, Pacific Islanders, and Filipinos, are shown one of the largest disparities for COVID-19 in the nation. Our team created a new model of testing at schools that was piloted at Kamaile Academy.
When initially approached to partner and do COVID testing at Kamaile, my first reaction is, let's do it. We have the flexibility, we have the autonomy as a charter school, but the real decision was about what's right for our school community to keep our kids and staff safe.
The type of test that we're doing here is a rapid antigen test, and the two types of tests that we're doing are the Abbott Binax Now and also the BD Veritor.
I think the PAAC program and the partnership that we have between Kamaile and PAAC is really strong, and I for one personally want to continue to be able to be tested. I want to know that I have that safety, and I want to go into next year with more assurances that things will be normal, and testing is one really good way to make sure that that happens.
It's a preventative measure. So we can come, we can gauge how are we doing in our own communities, with our own families, if we're keeping safe. And it's a good way to monitor. That's why I do it every week, and this is my third time.
It's been really important that we have accurate data during a pandemic so we can make the decisions at our school level. This type of data around COVID testing for our staff is just one more example. This data helps us to make decisions so that we can keep our kids safe and focus on learning, and our staff feels comfortable so we can focus on learning.
In parallel, we recognize that eliminating disparities must involve education. As such, we work with schools not only to test, but also to educate teachers and students. Our team developed a new COVID-19 curriculum that we hope teachers can deploy in the fall. We see teachers and schools as assets in preventing the spread of COVID-19 in Hawaii.
It's always been our belief that the more you can empower students and teachers to have the knowledge to take control over some of the various streams of information that are coming in, that you will have a better control over health. You'll have a better understanding of what is a reliable source of information. So you can go to the modules. We have two different forms of how you can learn about the modules and teach from the modules. One is by videos, and each is about 15 minutes, and the other one is through a PowerPoint presentation. So we're really looking at students and educators in general being able to be collaborators and partners with our public health.
The COVID-19 pandemic has had a huge impact on communities across Hawaii, but we are certain that by bringing together partnerships to address the disparities, to get people tested, to keep people healthy and safe, that we're going to be able to get through this together.